Yeah, my name is Thomas Vogl. I'm a group leader and assistant professor here at the Medical University of Vienna at the Center for Cancer Research, and I'm also the coordinator of the ID-DarkMatter-NCD project. And probably you're asking yourself, what does the title stand for? ID-DarkMatter-NCD. So ID and NCD are abbreviations. So NCD stands for non-communicable diseases, and these are diseases that are not transferred by infections. So they include diseases such as metabolic diseases, but also immune-related diseases. For example, long COVID or multiple sclerosis or inflammatory bowel disease are diseases that are not directly triggered by an infection, or at least we don't know if an infection is triggering them, and then they have still a severe impact on our health. And what we are trying to understand is if any of those non-communicable diseases are still triggered and affected by infectious diseases. So for long COVID, for example, or post-COVID condition, as it is also called, this is quite easy to understand. Obviously, you need an infection of SARS-CoV-2, of the coronavirus, and then you may get long COVID. But you cannot get long COVID without a SARS-CoV-2 infection. But for other diseases, such as inflammatory bowel disease or multiple sclerosis, it is much less clear if there's an infectious disease triggering the NCD. And so we like to see all those unknown infectious diseases that can potentially impact non-communicable diseases. Those we recognize as a dark matter. And in this project, we are using novel technologies to basically test for associations between infectious diseases and those non-communicable diseases. And beyond that, if we stick with the example of long COVID, there is not every person with a COVID infection, with a SARS-CoV-2 infection, also gets long COVID. So there are some environmental and some genetic factors impacting this, which we also research within the DarkMatter-NCD consortium.